Our coronavirus update. The coronavirus update today, as of 5:30 a.m. Central Time. All these stats are from Johns Hopkins. The total confirmed cases worldwide now 126,611. That is up from 114,000 yesterday. Total confirmed deaths worldwide up about 200. Patients that have recovered from COVID-19 worldwide, 66,894. 120 countries now have confirmed cases. That's up from 115 yesterday. And yet 6 new ones have come online with suspected cases. The good news is the number of people that have this that are requiring hospitalization, and 4% of them requiring ICU, it continues its steady drop. It had hovered at about 19%, so about 20% of people who got this needed to be hospitalized. That number today stands at 12%. That's really good news. But this is the key to understanding what the conflict that you're hearing in messages. Some people say it's nothing to worry about. Some people say it's just like the flu. Here's what you need to understand. 12% of the population that gets this will need to be hospitalized. We don't have room in our hospitals for 12% of the population, especially if we're all tongue-kissing each other at a Grateful Dead concert. That's why they're saying stay home. It's not that you're going to die. It's that we're killing the resources and in some cases, quite literally, the doctors who are going to be able to treat. In Italy, I started the program. If you missed it, make sure you listen to the podcast today. You can find it wherever podcasts are found, but listen to the podcast. I read 2 stories from doctors that rolled the dice and took the chance of speaking out that are absolutely terrifying of what the conditions are like now in Italy. Italy has the highest population of elderly in all of Europe. That's why Italy is being hit so hard. And anybody who says, well, it's just old people, really? You're going to be old one day. Just old people? When you read what the doctors were talking about, how the doctors and nurses are doing everything they can to save people, but they can't. They're turning people away who have had strokes. Patients who are on kidney dialysis are losing their lives because of this. They can't do anything else but care for those who are now in ICU. And ICU is now pretty much the whole hospital. This is what's happening in Italy. And this is why we're shutting everything down. And they say, don't spread it. Stay at home. Even though the numbers are looking better every day, we are about to get hit with a tidal wave of new cases. You're going to know people that have this. You're most likely going to have to stay at home. There's going to come a time where your kids are not going to school, and they may not go to school for the rest of the year. Why aren't we just closing down that human petri dish for virus, which is every school in America? Why don't we just shut them down? Because about 44% of our population, they don't have the insurance or the system at their work that they can go home and work from home or go home and get paid. When you have that issue, it becomes a massive burden on those families to have the kids at home. We'll hire a babysitter. Who? The U.S. now has 1,015 confirmed cases and 31 deaths. We are going to see that number of the confirmed cases skyrocket soon. As I said earlier in the program, we are about 50 days from where China was. We're 50 days behind them. I gave you the headlines 50 days ago in China, and it sounds like the headlines today in America. This is going to calm down, but we are in, I think, a 50, 60-day period before we really start to see this thing turn the other direction. New news that I have heard today. I'm waiting for I'll give it to you tomorrow after we get confirmation on it. It's good news, by the way. I just want to make sure that we are confirmed on this. All right. New Rochelle, New York has now just put a 1-mile containment zone by the National Guard in place. New Rochelle is the largest cluster of confirmed cases in the U.S., with over 190 suspected cases and 61 confirmed cases. This is right on the edge of New York. All public gatherings have been ordered to be canceled, including school and church gatherings. Governor Cuomo has said this is not a quarantine. Individuals are not prohibited from entering or leaving the area. National Guard troops will be used to help deliver food to residents, provide traffic control and medical personnel and emergencies, and to assist in cleaning and disinfecting public places. The New Rochelle Superintendent of Schools announced that for the next 2 weeks, students may miss, and summer school classes will be utilized to make up any missed instruction. Meanwhile, colleges and universities all over the country are starting to say, as in Cambridge yesterday, you've got 5 hours, get your stuff, get out. All classes now are starting to be moved online. American lives are going to change. This is according to Dr. How do you say his name? Fauci? F-A-U-C-I, Fauci. He is the director of the National Institute of Allergy and Infectious Diseases. He's one of the guys on the Mike Pence team. He said, we'd like the country to realize that as a nation, we can't be doing the kinds of things we were doing just a few months ago. It doesn't matter if you're in a state that has no cases or just one case. This is the big thing that I am trying to get a handle on what the tripwires are. I'm looking for tripwires in my own life. No one is telling us, but the governments have some sort of tripwire because they're all closing things. I just don't know what the milestones are that you have to hit before they start closing things. It may be, I can't find the official tripwires because there are no official tripwires. It's just somebody going, you know what, let's close them now. I'd like to know what those are. We can't find them yet. U.S. Health and Human Services Secretary Alex Azar says the biggest intervention should be reserved for areas with clusters of cases, such as Santa Clara, California. He echoed federal health officials' advice for people at higher risk. He said, I encourage any individual who is elderly or who is medically fragile to think long and hard about going into any large gathering that would involve close quarters and potential spread. I personally think this is why Bernie Sanders is canceled last night. I don't think it has anything to do with how the election turned out last night. I think it has everything to do with Bernie Sanders being a prime case or a prime target for something like the coronavirus. The same could be said for Joe Biden. I think it would be very prudent if all of these things stopped dead in their tracks. I feel for the president because the president, it's the only safe space I think he feels he has. It's the only place. In watching him speak at CPAC, to me, I understood him so much more. And watching the way he observed the audience and watching the way he was interacting with the audience, I think this is the only place that he feels like he's in a safe space. He knows that the media is going to attack him, but he feels like those large crowds are his friends. And I think those people in those crowds feel like they're his friends.
I think it's quite clearly his favorite part of the job.
I think so too.
Right? Like you think about, a rock star, like they got to sit in the studio all this time. They've got to sign records. They got to go into meetings about promotion, and then they get to play live. And that's what they love.
Right.
And that's what Trump loves.
And I think it's deeper than that. It's not that he just loves to do that, because I think he does. He loves that. But I think it's the only place. Imagine playing in clubs where everybody was like, oh, geez, they're coming back up on stage. These guys suck. And then you go to your hometown and you're playing where everybody loves you. I think that's a big difference with Donald Trump.
Yeah.
But these guys, we have to protect the president. And I think Bernie Sanders and Joe Biden should seriously consider how they're doing their rallies. It's going to hurt the election. But speaking of hurting the election, could you please write down, Stu, as we go through the election, what the Republicans and the Democrats, what Republicans have already done and the Democrats are thinking about doing on the upcoming primaries. Coronavirus conference in New York. Let me say this again. The coronavirus conference in New York was just canceled. Because of the coronavirus. Doctors speculate that the reason why the case fatality rate in Italy is so high is because of age. Italy has the highest confirmed case count outside of China. The fatality rate is over 5% of total cases compared to just 3% in China. It's because Italy has the oldest population in Europe, with 23% of the population over the age of 60 compared to 18% in the U.S. 23 versus 18. Italy's median age is 43.5 compared to 38.3 in the U.S. They have tested more than 40,000 residents for COVID-19, and the fatality rate may actually be closer and more accurate than it is in the U.S., at least for Italy, because we are not testing enough people yet. If we assume that there's a 1% case fatality rate for COVID-19 and a full year of spread, as we would get with the flu season, 60% of the U.S. population will get sick. 60% of the population will get sick. Now, you compare that to the worst years of World War II and the Vietnam War in terms of U.S. deaths that year. In 1944, the U.S. population was 130 million. Combat deaths, 126,000. 1968, the population was 205 million. Combat deaths, 16,000. 2020, 331 million Americans today. U.S. combat deaths, 120. Now, if you compare those, the flu deaths, the World War II combat, 126,000. Flu deaths, 13,000. If it was COVID-19 today, 780,000. There were only in Vietnam, there were only 16,000 deaths in 1968 from Vietnam. There were 20,000 flu deaths. We're talking 1.3 million deaths in 1968 comparison. Today, 2020, 331 million. The combat deaths, 120. Flu deaths, 33,100. This could take 1,986,000 Americans. We don't know yet, but if this plays out at 1% and it doesn't have the seasonal flu break, that's what we possibly could be facing. That overwhelms every system we have. And I know this audience knows what overwhelming the system means.